Hello, everybody. My name is Juliana Gutierrez, and today I'm going to help you become a little more familiar with malaria. So, malaria is a serious and sometimes fatal disease which is caused by the bite of a parasite infected mosquito. First, let's begin with the causative agent. The causative agent of malaria is a single celled protozoan parasite of the genus Plasmodium. And there are four kinds of parasites which can infect the human from the Plasmodium genus. So those are the Plasmodium falciparum, vivax, ovale, and malariae. Depending on the developmental stage and the species of the Plasmodium, the shape can range anywhere from spherical to crescent, elongated, and even ring-shaped. Plasmodium uses a substrate-dependent form of locomotion known as gliding motility to migrate its way throughout the cell. And since Plasmodium are not bacteria, they don't have a uniform grand staining pattern. Here you can see images of the causative agents. So on the left, we have our Plasmodium species, which you can see from a more microscopic level. You can see there's different forms, and you can also just see the sort of different shapes they tend to take on. And then on the right, we have our Anopheles mosquito, which is the vector for this illness, and will go around from person to person, biting and spreading the disease. As for signs and symptoms, a malaria infection can usually be indicated by the following signs and symptoms within a few weeks of the initial bite. However, it's important to note that certain forms of the Plasmodium parasite are capable of lying dormant within the body for up to a year. Symptoms for malaria tend to be pretty flu-like and tend to be more focused around fever and the body trying to work its way back to homeostasis. So that'll be headache, vomiting, diarrhea, shaking and chills, anemia, and jaundice, which are due to loss of red blood cells, sweating, and high fever. Pathogenesis and virulent factors. So, to begin, the infected mosquito starts hunting most commonly in the evening and is attracted to exhaled CO2 and certain bodily odors. At this point, the Plasmodium resides within the mosquito's salivary gland and is still developing. Upon biting, the Plasmodium, known as spirozoites, are spilled into the new host's bloodstream. And once inside the bloodstream, the Plasmodium infects and destroys hepatocytes and red blood cells. Eventually, the sporozoites reach the liver and enter the hepatic cells where they undergo asexual reproduction. And as for virulent factors, the Plasmodium falciparum tends to be the most deadly of the malaria parasites. This particular virulence of this species derives from its ability to subvert the physiology of its host during the blood stages of its development. And here you can see some images of what exactly that process would look like. Transmission. So, because the parasites that cause malaria affect the red blood cells, people can also catch malaria from other ways besides just being bitten by an infected mosquito. So, this can be through exposure to infected blood from the following. So, that can be from mother to unborn child, which is known as congenital malaria, through blood transfusions, through an organ transplant, and by the use of um, shared needles that have been used to inject drugs. Diagnosis. Blood tests are the most commonly used form of diagnosis to discover the presence of the parasite which causes malaria. These tests can be used to indicate which type of parasite may be causing the symptoms, as well as if said parasite is resistant to certain drugs, and whether the disease is affecting any vital organs within the body. Some blood tests may take multiple days to complete, whereas others are capable of showing results in as little as 15 minutes, which would be the rapid dipstick tests. And here you can see an image of what that rapid dipstick test would look like. Treatment. The types of drugs prescribed as well as the length of treatment will vary depending on the following, which is your age, the type of parasite, the severity of the symptoms, the anti-malarial status of the patient, and of course, whether or not you're pregnant. And at the very bottom, you can see the most commonly anti-malarial drugs which are prescribed. Prevention. So there are pretty much three main forms of prevention or pathways which can be taken to prevent malaria. So we can start off with the prevention of man to vector contact. So this includes the use of insecticide bed nets, the use of mosquito or bug repellents, and the use of full body clothing. Next, we can reduce the vector density by destroying the breeding places of the vectors and the use of insecticide sprays. And finally, we can reduce the parasite population through early detection and treatment. The World Health Organization also recommends the broad use of the malaria vaccine among children living in regions with moderate to high Plasmodium falciparum malaria transmission. So, this is a vaccine which has been shown to significantly reduce malaria and severe malaria among young children. Epidemiology. Malaria is a global health crisis which is prominent in South America, Africa, South and Southeast Asia. So, according to the World Malaria Report, there were 241 million cases of malaria as of 2020, compared to the 227 million cases in 2019. The estimated number of malaria deaths stood at 627,000 in the year 2020, and the most commonly affected groups include young children, pregnant women, immunocompromised hosts such as AIDS patients, and travelers. And here you can see a map on the areas which are most commonly affected by malaria. So in the red, we can see regions which are controlling malaria. The blue is areas which are doing their best to eliminate malaria. And in the green, we can see all the areas which are malaria free. So as you can see in the United States, we are completely free of malaria because as of the year 1951, the United States was considered to be completely eliminated and eradicated of malaria. And finally, we have my sources. Thank you.